Dementia is an umbrella term for conditions causing impairment of cognitive functions like memory, abstract thinking, reasoning, attention span, etc. It is a progressive disease. There are various causes of dementia. The commonest cause of dementia in our country is Alzheimer's disease. About 60 to 70% of dementia consists of Alzheimer's disease. The other conditions include vascular dementia, Parkinson's disease, Lewy body disease, traumatic brain encephalopathy, HIV infection. There are certain reversible causes of dementia like vitamin B12 deficiency, hypothyroidism. There is an entity called pseudodementia where the patient suffers from depression. It is a progressive disease and we have to be very careful about the symptoms. The symptoms include impairment of memory. The patient often finds difficulty in naming and sometimes get lost in the familiar surroundings. There is impairment in problem solving and he needs help for the activities of daily living, and there is sometimes language problem. There are also some psychological manifestations which accompany dementia like anxiety, depression, panic attack, delusion and hallucination. It is a combined teamwork and sometimes we have to take the help of the psychiatrist to take care of the psychiatric problems. Apart from these symptoms, the patient may have social incontinence, fecal incontinence. There may be sometimes convulsion, and in the late stage, the patient becomes bedbound. There are various stages of dementia, and in the late stage, the patient cannot identify himself and needs help for the activities of daily living. There are certain drugs which help in the treatment of dementia. Certain drugs like donepezil, rivastigmine, galantamine. Certain drugs like NMDA antagonists like memantine. Certain new drugs are coming and certain drugs, anti-amyloid drugs, are also on the picture. It's a team approach for care of the patients with dementia, and caregivers must be aware of the symptoms of dementia and they must be very patient, and the family members must be counseled regarding the signs and symptoms of dementia. And in a case of any emergency situation, they must be in touch with a physician. It is a combined approach, and apart from the medical treatment, there are certain therapies like cognitive therapy, behavioral therapy, and physiotherapy. Apart from these therapies, musical therapy is also important in the treatment of dementia, which help to the patient to take part in music like singing a music, composing a music, and playing instruments like this. So, dementia is a broad term. There are various causes of dementia. We must know the signs and symptoms of dementia and must make the patients aware of the signs and the symptoms. And if they know the early signs, they can contact their physicians early and take care of themselves. Thank you.